So generally we'll find that having endoscoped the horse, we'll find a problem, the majority of which will resolve with time. So if the animal has, say, a minor upper respiratory tract infection, that's what's causing it to make an inspiratory noise, that'll resolve over time. If we find, say, mucus in the lungs, we can take a sample, do a bronchoalveolar lavage, figure out, does the horse have a dust allergy, does it have a lung infection, has it bled into its lungs after exercise? We can instigate medical therapy and lifestyle changes to try and manage that. So if the horse has a dust allergy, for example, we'll often recommend a dust-free environment, keeping the horse outdoors as much as possible, feeding them soaked feed and so on. A lot of trainers now are starting to make outdoor stables where the horse basically lives outdoors as much as possible, and they found that helps a lot with airway problems. If the animal has an infection, we can treat that. If it's got inflammation, we can give it anti-inflammatories and so on. So there's a variety of medical and husbandry approaches that can be taken. However, there are some physical problems or abnormalities or conditions of the respiratory tract that are amenable to surgery. So there are some commonly performed equine respiratory tract surgeries, including Hobdays, tie backs and tie forwards. They all are the colloquial names of various procedures. Again, see Surgical Nursing 2 for the specifics on this, but patient positioning is key. And bear in mind as well, when the horse is having head and neck surgery, you can't see its head, you can't examine its eye. You've got to think about monitoring anesthetics in a slightly different way. Okay. Aftercare, again, see your Surgical Nursing 2 for the specifics for each procedure, but bear in mind, we've got to monitor the animal carefully for any sign of respiratory obstruction, both after extubation, and then can the horse eat normally when it's back in the stable. If it had airway surgery, it may have a painful or inflamed larynx and pharynx. It may struggle to eat, it may cough, it may have food coming back out its nostrils depending on the procedure. So aftercare is important. Whether you feed the horse from the ground or from chest height depends on the procedure. So check with your surgeon. There are specific post-operative feeding recommendations for individual procedures. And if the horse has an open wound, like a Hobday, you'll have to clean that. So just have a look at your Surgical Nursing 2 lectures for the specific aftercare for each condition. Just to mention tracheostomies as well. This is making an opening into the trachea to relieve upper respiratory tract obstruction. Most of them are elective, so we can anticipate airway problems. So for example, if a horse needs to have quite invasive sinus or upper airway or nostril surgery, we can anticipate post-operative swelling. So we may elect to place a tracheostomy temporarily to allow the animal to breathe through its trachea until the swelling reduces after the surgery. Once we have a tracheostomy tube in place, you have to clean it every 3 or 4 hours to prevent it getting blocked. So these animals require round-the-clock monitoring. You can't go home and leave them overnight. Most procedures are elective, but occasionally you may have an animal that gets acute upper respiratory tract obstruction and you have to perform an emergency tracheotomy or tracheostomy procedure. So have a kit available in your recovery area and make sure no one ever borrows things out of it, that it's always there, everyone knows where it is and it's fully stocked at all times. The Equine Hospital Manual by Corley and Stephen goes into detail on this, so if you want some information, that's a good place to look. If you do find a horse developing acute airway obstruction after surgery, say for example in recovery you extubate it and the horse starts to have trouble breathing, often they'll panic and thrash around violently. Now this is dangerous. Be really careful at this point. Do not go in there on your own and try and handle the horse. They're panicking and they will injure you, not through any malice, but they're just frightened and it's a very, distressing situation for them. So what you have to do is wait till they fall over and then rush in. And really it's as basic as sticking something sharp through 2 tracheal rings in the mid-third of the trachea and turn the blade to hold the incision open. And that's enough to let the horse breathe while you figure out how to maintain its airway patency after that. Again, if you want more information, have a look at the Equine Hospital Manual section on tracheostomies. That's available from the library as an ebook. You may have heard in the past of horses having a permanent tracheostomy, where a permanent tube was placed in the trachea. It's often called tubing by owners. It's rarely performed now because laryngeal surgery has improved so much and it's also not permitted under the rules of racing. So 20 years ago it was well, not common, but you would see the occasional horse that had been tubed. It's, as I say, rarely performed now. The obvious disadvantage is with the open airway is that if the horse falls into water, they can drown, which is obviously a problem. So it's probably not something you're going to encounter anymore. Okay, so I'm going to stop there. That's a quick overview of equine upper respiratory tract diagnostics, and particularly endoscopy, and some pointers on the type of patient care procedures you may find yourself dealing with. If you have any questions on that, please feel free to post them on the Moodle forum for me. I'll get back to you. Thanks very much.